So I'd like to introduce Robin Beardsley, Dr. Robin Beardsley. She's from out by Toronto on the east coast of Canada. And we have invited her to present for us today, present for all of us. And she's going to present on Know Thyself. Is that right, Robin?
Mm-hmm.
Yes, great. So I'm going to
Capital
turn
S.
capital S, yes. So I'm going to turn it over to you and we're
Sure.
recording. So go ahead.
Thank you. Thank you.
Welcome.
Wow, I'm just going to take a moment to really take you all in. And what I've noticed in this pandemic and what I'm learning is the first way that we actually regulate ourselves is with connection. And we're not getting that in our day-to-day lives. So really just taking in everybody here and smiling and seeing old friends. And it's just lovely, and seeing new faces. So I'm just going to go to the second screen for a moment because I don't want to miss anybody. So yeah, lovely. Hello, yes, leaving. So yeah, so hi, my name's Robin Beardsley. I'm a family physician and recently gave up my practice, medical practice, and I'm just doing psychotherapy. I've also trained in mindful self-compassion, so I'm teaching courses and doing lots of work around resiliency, and just really, I've noticed this distress that I felt a couple of years ago as to what got me out of medicine. So really looking at this difference between empathy and compassion. So that's what we're going to talk about today, because I think sometimes, I was taught to, be empathetic towards your I'll say patient, but no, so I'll try saying client, but I just say patient. But so that empathy that we have for others, and it's kind of like it's an effort. And so I'm noticing this efforting of trying to do a good job, leaning in, really holding, really trying it, trying my best. And so I love this poem or this reading that Jennifer did. If I can take some of the words that resonated with me, it's like there's nowhere to go. Just imagine that, nowhere to go. And no waiting for something to happen. All this trying, give it up. So even as you're here today, see, being in self is not about getting somewhere or attaining something. It's actually about letting go. Yourself is just, it's here, it's available. And so it's really about just kind of relaxing into it, which is so foreign. I don't know about you, but it's really foreign to me because, I'm the go-getter and have to work and put my head down and get through. I needed all that to get through med school. And what I'm noticing, and as I do my own therapy work, I'm doing deeper work these days about my thinking part. My brain got me through this life, but my body got turned off. And so if we're really going to be in self, we have to be in body. And the body is sometimes scary to be in because it's having all these feelings and our nervous system is doing stuff. And so we are in this whole pandemic is a threat. So we are constantly in our threat defense system. And so I love the neuroscience part of it because there's nothing wrong with you. It's just what your body's doing. Your body is in the fight and threat defense system. So we're going to talk a little bit about that. How do we regulate that, or how do we just even being aware of it? And that's the mindfulness part, is we need to be aware of it if we're actually going to do something. And so something happens when we are with another, we are impacted, we resonate with another. And so our bodies are going to have feelings, our bodies are going to have emotions and thoughts. But if there's something about what I do with that, how I relate to that, that then takes me out of self. So that's why we talked about, sort of the title. I'm just going to start my slides here. Hopefully this works for me, all this technology. So let me just go here. Okay. So this Know Thyself, it's really about, I'm doing some work, Joan Halifax, who I can't remember exactly right now where she's done lots of work on compassion, and so I'm doing a course online called Compassion at the Edge, and so it's really about getting to know you. Okay, so if we look at the difference between empathy and compassion, and empathy is really that feeling into somebody, feeling into another. It's that resonance that happens as we're with you. It's what helps us to be human, because I can know some of what is happening for you. There's this sharing or resonance that happens, but there's also what can happen is when we attune to someone else, it can actually lead into distress. It's like you start feeling things as if they were happening to you. There's this vicariousness. We talk about vicarious trauma, because as I'm listening to your story, it's as if my brain is experiencing it, and I can't tell the difference between your trauma and what I'm feeling. And so this vicariousness, it actually changes our perceptions on. So in our iceberg, it changes the perception level. And so I also, just as I'm talking about this, I want to make sure that I've given my PDF copy of my files to Jennifer, so we can send them out. You're welcome to take pictures right now, but this will be available. So that sense of just allowing yourself to be here. So compassion is really feeling for. It's being with. It's like I'm here with you, but I'm separate from you. There's a sense, there's just that difference. It comes from a different place. It includes empathy for sure. And it helps us to attend to someone so that we can actually feel what's going on. And it's coupled with the desire to help someone, this well-being of another. So it also comes from a deeper place. There's deeper connection, deeper intention to be of benefit, to serve. We are actually, we all come from this place of wanting to serve, right? If we look at our yearnings, wanting to make a difference, who you are in this world makes a wonderful difference. If it weren't for you, we wouldn't have that one drop in the ocean. So being with another or holding space for another. Sometimes in grief work, they talk about companioning with another. That you can't do things on your own. It's just so much easier, because as you're connected with another, then that it just you're holding another while you're being held almost. But it does require some attention. It requires a bodily awareness. So an embodied, it comes from this deep sense within ourselves. And so it's also, how do I balance my affect? How do I balance my emotions? And an ability to distinguish, this is you, this is your pain, and this is mine. And so even, I teach self-compassion. And so the ability to see that what's going on in a part of me or in one level of the iceberg, that's not all of me, right? But sometimes when we're angry, you're in anger, it feels like all of you. So that ability to distinguish that it's a part and self. So the same thing is with me and you, that there's there's a separateness. We're together, but we're separate. And that's a big thing in terms of this empathy and empathy distress. So if you look at how do I experience empathy? Because for me, as I was looking at this, empathy really is in the upper levels of the iceberg. It's in that survival energy of the iceberg. It's like, so if I'm really distressed with somebody, then I might start feeling badly for them. I might start feeling upset. It's like, what's my behavior? I might lean forward. Or if I'm repelled by something they're talking about, I might not even know it and I'm leaning back. So even just our body awareness will give us some sense of what's going on for us and whether we're in empathy or whether we're sitting in compassion. Some of the other things that can happen is if we have feelings of worry, and you start to worry about yourself. Oh, if this is happening to them, I wonder it's going to happen to me. And then there's, right away, there can be some shame and guilt about, oh, I'm worrying about me, but I'm supposed to be with them. It's so complex when you actually slow down a therapy session of what's going on. So there's me, there's you, and then there's connection in our therapy session. And if we move down, in compassion, you could see compassion. I love it. John once said, self kind of moves up the whole iceberg. And if you have compassion at every level, I can have compassion while I'm having thoughts. I can have compassion while I'm having feelings. And so this self energy just moves all the way through the iceberg. So some of the other things I like to think about this is when I started really looking at attachment, and I actually remember Linda was the first place I heard about this, you know, what's my experience of me while you're experiencing me? Like it's just this sort of strange way of, so, you know, if I think about my family of origin, when I had anger as a kid, my experience of others is that they would withdraw or they would send me away. So my experience was anger's not good. And so then in therapy, I take that same bias that I've learned that I don't even know about, it's implicit. It's like I may judge a client who's angry and I don't even know that I'm judging them. Or I might be mad at myself because I'm feeling angry toward a client. And that's where we can get into some empathetic distress. Whereas if I can come down, so one of the questions to ask yourself, if you're really not sure if you're in self, how do I feel towards this client? So if I'm feeling judgmental, I'm not really in self. You know, there's probably a lot of self energy, but it may not be totally in self. And if there's judgment or there's fear here, then I can't be with you. It's my fear that's with you. So one of the good questions I ask myself, how do I feel towards? If I have a compassion for, so if I'm angry and I can have compassion for that part of me that's angry, if I can validate, of course I'm going to be angry. This is such a terrible thing that's happening to this client. So then if I can give some space for my own anger, then I may be able to reconnect with myself and with them. And if I can't, then what's going to happen is we're going to go into this, it's going to become a personal distress. We'll get into our own threat defense system. And that's what happens. It's empathy resonating becomes distressing because it feels like it's mine. So when we talk about, it used to be called compassion fatigue. They're actually changing it because it's empathy fatigue. It really isn't about, compassion is endless. We don't lose compassion. So another way I talk about it is caregiver fatigue. But exhaustion, depersonalization, and decreased job satisfaction. Those are the three things that show up. But it makes so much sense when you look at it from a brain point of view or a neuroscience point of view, because it's really our threat defense system that is coming into play here. So this personal distress, it's like you're overwhelmed by the suffering of another. It becomes too much. And especially in this pandemic, what's trauma? Too much, too soon, and uncontrollable. And that happened like overnight. It felt like we were in this situation. So not only do I want to alleviate your suffering, but then I also want to, then there's something about I need to alleviate mine. It's like I can't get away from my own. So that gets me into some distress. How do I cope? The biggest thing, the way that I cope was do more. Like, okay, I'll just learn more. I'll figure it out. I'll keep going. I'll book more patients because there's need is great. And that leads to exhaustion, right? And so it makes so much sense why exhaustion is one of the first things that we see. And it also activates our threat defense system. So our threat defense system is the fight, flight, and freeze. There's also the if you want to learn more in polyvagal theory of where we get mobilized, so we're in that sympathetic a part of our threat defense system. And then there's actually a immobilization where we actually shut down. So the first part, if we're fighting, we might get into something that Joan Halifax talks about, moral outrage. So I can start colluding with the patient's anger towards their boss. I might, instead of being open and kind of hearing it, I'm going to collude with it. Of course, or I might collude with their fear. I might actually become irritable or resentment. What I'm noticing right now is my irritation and impatience with people is so high. I have to really watch that in sessions these days. Why can't you just get it? Anyway, that's been there a lot these days. So then this flight, the moral avoidance, I don't talk about certain topics because then I can't handle it anymore. I don't want to talk about that anymore. So I don't even ask the question. Or this moral apathy. I'm really seeing this and feeling this. It's like, I don't really care anymore. Don't tell me anything more. Or you tell me and it doesn't even faze me. So there's this moral apathy that comes up, or depersonalization. We start to compartmentalize. And so it makes sense if you're exhausted and you're not with people and you're not connected, you're going to have decreased job satisfaction. So it's nothing wrong that you're doing. It's just the nervous system. And if we can start to befriend our nervous system or start to understand it, this is where my brain loves this stuff, because it just kind of makes sense. And for me, when things make sense, then I can kind of relax a little bit into it. So this self energy, how do I know when I'm experiencing self energy? I've started asking myself this question, and it's some of it is, how do I feel towards somebody? And can it be a body sensation? And that's been the hardest thing for me, because I thought I was in self energy, and it was a thinking process. And now I'm looking at, okay, how am I in my body? Like a while ago, I started noticing tingling when I would say something to a client, and it would be like, they would resonate with them. It's like, yeah, we got this, right? So I started to actually trust that. When I had tingling, it was like, okay, we're on the right track here. So I started looking at, okay, I've discovered lots of ways that I'm not in self energy. So I'm going to start there, because I know when I'm not in self energy is if I'm trying to fix something, right? If I'm here with an agenda, and medical doctors, that's what we are trained to do. Find the problem, fix it, cut it out, get rid of it, medicate it. And yet, that's not what I do in psychotherapy. I'm here to actually be curious about it. And this whole word, I love that you use that word, Linda, curiosity, because I can be curious in problem solving. I'm going to figure it out. Let's just, go for it. Or I can be curious in an open, expansive, what's really here? So just noticing even your curiosity can be one that is less self-led or less self-energy. So if I'm directing, if I'm working too hard, if I'm numb or guarded, right? If I notice that I'm starting to have impatience, and it's not that that's so bad, it's just I have to say to that, that side of me, it's like, whoa, I'm impatient. We need to slow down here. Or if I notice that I'm leaning way in, it's like I'm not giving the patient any room, or I'm leaning way back. If my body, I don't know about you, my body is screaming at me these days. I have been having lots of headaches again. So I'm really starting to look at what's going on with that. What's my body trying to tell me? And I've ignored it for so long that, I tend to keep doing that and ignoring it. So looking at for me, it's starting, how do I know when I'm not in self energy? It's kind of that helps me to know when I am. So I'm experimenting. How do I know? So compassion really is about fixing or protecting yourself. And if we look at Satir's relationship, I, thou, or self, other, and context, and then Dan Siegel talks about this we, when we're here together, the context of what do we create? What's the context of the therapy session? And I'm trying to take this even out of therapy. Who am I in my relationships outside? Because this self-energy is not something that I'm going to do in therapy and then I'm not going to have it at other times, right? Sometimes it's easier to have access to self when you're with a client and not with your other relationships, but really experimenting with some of that. So then I took compassion, and if we put it into the self, so self-compassion is really about, from my experience, something that's really helped me is a part of me is suffering. So that if I'm aware of something that's going on, it's not all of me. So a part of me has an expectation, a part of me is thinking, a part of me, is feeling. And so you can even take all those levels of the iceberg, and it's not all of you. We know that. Compassion for the other is remembering that they are whole and they have resources, because sometimes we can get so stuck in their what they're presenting, their iceberg of suffering, that we can't see anything else. Or this universal compassion, it's like it's always available. And so can we bring that? I sometimes like to imagine it's like when I'm sitting with you, even right now, there's this beautiful context of compassion. It's like we're swarming in a sea. If you just look around you in this the collective energy that's here in this room right now, and we can draw on that. There goes the shivers in my body. That's kind of cool. Sorry, I just love it these days when I get it, when I kind of feel that. So that's kind of cool. And it's available all the time. That's what's so cool, is that it really is available. All right. So for today, I don't know, I can't remember, Jennifer and Linda, if we have any questions now, or if we just go straight to the kind of reflections in your breakout rooms. These are some of the things that you might think about. And so, here's where you could take a picture or write one question that kind of resonates with you. it just is an exploration. You know, how do I experience myself when I'm in the presence of another? So how do I experience myself when I'm in the presence of another who's suffering? Or someone who's in there coping? There's a good one. How do I experience myself when someone's blaming everybody? I was getting really mad at people that were just blaming everybody else. You know, if you just stop blaming people, then you'd know what to do. Right. So I had to look at that. So how am I in the experience of someone who's pleasing everybody? Right. It's like, oh my God, I get so mad at you. Why don't you just stand up for yourself? So it's funny. I think I'm really irritated these days because that's what's coming up in all the response to people. You know, what if someone can't get out of their thoughts? You know, if you just got in your body, it'd be so much better. Right. So just that sense of how do I experience myself? And if I'm not experiencing myself kind of as this open and expansive and curious, then I may not be in self. It doesn't mean it's bad. It just means it's okay. What do I need? What do I have to do in this moment? And it might be, let's just take a moment. I do that so much now. It's like, let's just take a breath. Like, let's slow down here. It feels like something's going on, but we're, you know, and I do it as much for me as I do it for them. What do I notice about my body as I'm experiencing other? Or how do I experience myself? So how do you know you're in self energy? So those would be the questions that I would reflect on today, or, you know, anything else that we've talked about here.